Hi, I wanted to do another update. I was 6 weeks last Thursday and it's Sunday now, so um, I'm a little over 6 weeks. Don't mind my dogs, they bark a lot. Anyways, my last video I was talking about a seroma that I had, and what ended up happening, I would say the night that I made that video, is I started having more pain in my stomach, and so I ended up getting back on some of my pain medication, which was liquid codeine and some Tylenol. And then I just rested. And then from then on, I went in to see the clinic and they thought I still just needed some more rest. But from the incision up to my ribs, it started getting like swollen and hard. And by the Sunday night, I decided to go into emergency. I was trying to wait for an appointment with my family doctor, but I just didn't want to anymore. So I went in, and there was no redness on the outside. It just felt really swollen, and it was sore up to like my rib area and over to my side. And the emergency doctor said instead of getting a CT scan, he would prefer if I got an ultrasound the next day and try to diagnose it that way, because once you get bypass or have weight loss surgery, then the instances of having CT scans goes up, because if you come in years down the road, they might need to look and see what's going on, so that's more radiation. So anyways, he said that I wasn't in any immediate danger. All my vitals were great, and I was still able to eat and had no problems eating and anything like that. I just had pain and it was swollen. So I went and had the ultrasound, not the next day, but the day after, and then went right back to emergency. And they said they couldn't see enough on the ultrasound to tell. There wasn't a huge, like, whole lot of fluid in there or anything. So they weren't thinking, they just couldn't tell. So they contacted my bariatric doctor and he said to go ahead and do a CT scan. So I had a CT scan and then they still couldn't really tell. So my bariatric doctor was out of town, so they called in somebody else, and he came in and assessed me, and he said he thought I should have surgery because he wasn't sure. He said there wasn't a whole lot of fluid in there. However, if there is something in there, he'd prefer to just get it out. So I went on the list for emergency surgery, and I had surgery the next day, and they opened it up, went in and cleaned it out, and then they told me that there wasn't really any infection in there. It was mostly all swollen tissue, but I was put on rounds of antibiotics in the hospital, and they left the wound open. So when I come home, I have a nurse come in daily to clean it. And as far as from what I can gather, although I'm still fairly confused, that there was a hematoma in there, which was just a collection of blood, which is normal, and sometimes the body will just reabsorb that. But somehow I had ended up with a tissue infection. And they also said sometimes they can swell from the stitches that are in there, but I'm pretty sure there was some type of infection or something. And so anyways, I'm on antibiotics and I'm feeling much better. My stomach is not as hard. It felt like before surgery, like it was as big as a baby's head right under that area, and it was so sore. And so, yeah, pretty much I'm just on antibiotics, and now I'm on the mend again, and it had really nothing, like it wasn't really anything to do with my like bypass. When they did the surgery, they didn't have to go back in. My stomach is healed and my bypass is healed, and they have no concerns with that. It was just from the incision, and they said like maybe only 5 out of 100 people will have this kind of thing happen. So anyways, I'm feeling much better now. I still have some soreness and all that, but I can tell I'm on the mend. So I got put back off work, so I won't be going back to work on April 3rd now. It did I wasn't allowed to eat for so long before my surgery, and then after surgery, it was like, I'm kind of like slowly getting back into it, so that's going to take me a bit. And during that week of not feeling well and swelling and water retention, which I still have some of, I gained weight, but I was barely eating. But I think I went from 316 up to 324, when I got home from my surgery the day, I was 324. But then, and my surgery was on Wednesday, and it's Sunday now. So from Wednesday to Sunday, I'm back down to 317. So I think within the next week or so, or maybe a little bit longer, as my body gets rid of all the excess fluids and stuff from this me healing and also all the fluids they give me for surgery, I should be getting back into the swing of things like a regular 6 weeks out from surgery or 7 weeks or whatever. But yeah, I just got some more healing to do. So yeah, I just wanted to update you because last time I was saying I didn't have to take any pain medication, but shortly after that I did have to start taking pain medication, and I'm feeling a lot better now. The pressure's like a lot off and all that. So yeah, I just wanted to update everybody on that. And I think that's all. It's Sunday, and I'll try to update again as I heal and get to be able to like start moving around like normal, because most people that are as far out as I am are feeling a lot better. So I look forward to that now, because I was like, wow, it's taking me forever to heal, but I think it was just that hematoma in there, and it was causing some irritation and that flesh infection. That's about it. So yeah, so now I'm on the mend, and that's all. Okay, I'll talk to you later. Bye.